My medical assistant students are, I'm on the right page. My medical assistant students are going over the phlebotomy, I apologize, the medical assistant pharmacology review. All right, so if you guys know the answer to some of these questions, go ahead and type it in the chat. Okay, so here's the first dosage calculation and or prescription. Bam. The provider is ordering Lamictal, 150 milligram tablets. Take one tablet daily by mouth before meals, one refill. So I give them a description and or a prescription, a medication, and I give them the details of that medication. So now they're writing it as a prescription. Lamictal is the medication, 150 milligram tablets. Take one tablet daily by mouth before a meal and one refill. So they have dry erase boards and they're documenting and or writing this prescription out. Of course, we know medical assistants only write and or upload prescriptions based off the provider's order. So this is the prescription here. So now they have to write the prescription in abbreviated form. Bam. So if you guys know the answer and or want to write out this prescription in abbreviated form only, go ahead and give it to me. We're doing a pharmacology review.
She said Lamictal?
Lamictal is the name of the medication. 150 milligram tablets. Take one tablet daily by mouth before a meal with one refill. And a lot of these prescriptions that they're writing is just not saying that this is a real prescription that a patient is going to receive. It's just for practice and documentation only. So here's the prescription that they're writing. But they have to write it in abbreviated form. For an example, tablet, take one daily, by mouth, abbreviation, before meals, abbreviation, and then they only get one refill. Lamictal. 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 Yeah. 150 milligram tablets. Take one by mouth. Take one tablet daily by mouth before a meal, one refill. And next you're going to tell me how many that we're going to dispense off of that one prescription. Thank you guys for joining. My name is Cynthia Jones. I'm the owner, director, and instructor for Healthcare Career Academy. I'm based out in Austin, Texas. Well, right outside of Austin, Texas. I have the medical assistant program, and it's a fast track program. It's 13 weeks. My medical assistant students earn their medical assistant certification, phlebotomy certification, and EKG certification in 13 weeks. So close. So close. Yes.
You said one refill?
Yes, with one refill. Thank you guys. I only have 2 likes. Come on, help me. Let's tap it together. I know it, y'all may be shaking as I do it. Let's see. So close. Don't erase. I'm sorry. This nut, it says my name. I speak a little English. Can I study pharmacology? Yes, and especially if you have a bilingual instructor, and or I always say if I have someone in my classes bilingual, I have them assist the students. Yes, yes. I'm saying yes to your answer, but you need to add a little bit more to that answer. You're on the right track though. You need to add a little bit more, because what we don't want to do is the pharmacy calling us back. You didn't hear it all? You don't want the pharmacy calling us back and say, hey, it's missing this. So the question is, the patient is prescribed Lamictal, 150 milligram tablets. Take 1 tablet daily, by mouth, before a meal, 1 refill. That's the order. And we only write a prescription. Shut your face, yes. Bam. Bam. Wait. Just keep it there.
Close order.
Take 1 what? 1 what? Tab. Let me see. 150 milligram tablets. 1 tab by daily, by mouth, AC before a meal, dispense. How many are you gonna dispense? Bam. On point. How many are you gonna dispense on that 1 prescription? Because it is 1 refill, right? So when they get it prescribed, the pharmacist is going to create that label, right, based off of that prescription. So it's going to say 1 of 1, meaning that it's 1 more refill. But how many is he going to dispense off of that refill right there? Remember, I mentioned the rule of thumb is how many? Oh, I have 206. Come on. Y'all like the live? I'm gonna follow you once the live is over, because I'm not kidding. I'm so new at this. I don't know how to bam. I don't know how to go in, find you, follow you. My daughter tried to tell me, but I got so confused. But thank you. Yes, both of you guys are right. Spot on, 100%. Now let's do some dosage calculations. So when we talk about, I'm sorry, her head moving. So if you guys see me look over there and say something like, shut your face, one of my students, bless her heart. So we know when we're doing dosage calculations, if you used to EMR, yes. But if the EMR system is down, just like T-Mobile and AT&T now, right? AT&T, right? It's AT&T. But T-Mobile isn't affected, I'm just saying. But here we go. If your EMR system is down, we still need to know how to document a prescription. Once EMR come back up, now we can document that prescription. So we always know that whatever the provider orders, because we're gonna do dosage calculation, the formula is basically looks like a fraction. So whatever the doctor order is on top, whatever's on hand is at the bottom. Then we're going to give the quantity. But when you give the quantity, we have to make sure how we're going to administer that quantity. So here it is. The provider is ordering 500 milligrams but what's on hand is 250 milligram capsules. How many capsules are the MA going to prescribe or give? Because this is the medication we have at the clinic on hand. To what? Shut the front door. I just said it. Shut the front door. Think it. You missing something. You two are missing something. Not you guys, but here on live. So take out the middle. Take out the middle, but yes. Take out the middle.
You said these are tabs? Caps.
Capsules.
Uh,
And we know, yes, bam, shut your face, yes ma'am, or sir, sorry, don't know. It says, do you actually have a class with full of students? Yes, so I do have a class. So my class is a medical assistant class. So they come in 5 days a week. So I cover phlebotomy Monday, Wednesday, and Friday. Medical assistant I cover on Tuesdays and Thursdays. But yes, I do have a class. It's not a full class during the day because I have what I call work-life balance. Bam, bam. I have work-life balance where they work remote. I saw yours. They work-life balance, so they do everything remote and they come in every Saturday. Can MAs give medication? Absolutely. If it's the medication they have on hand. Now we know medication comes in all forms, whether it's a vaccine given in injection or if they have the medication like Zofran for nausea. Awesome, I will follow along also. You're in the program? Great. But for anyone who's on this live that are in the program, please do not go tell your instructor, well, the lady in blue with the blue glasses said. No. MAs give Zofran? Absolutely. If they have it on hand. This is just a sublingual, it's a dissolvable tablet that they place underneath the tongue. If they have it on hand, the provider says, I need this patient 2 tablets. They're only gonna prescribe one though, but yes. I used to work in urgent care. And if they had it on hand, we gave it. But not all medications, right, that they prescribe, we have on hand. A medical assistant what? Yes. A MA, medical assistant. Oh, I knew you wasn't talking about medication aid, but medical assistants, yes. What is your live schedule? I don't really have a schedule. I think I need to create a schedule because I went on live last night. How can a MA give meds? With a doctor's order? Well, I'm going to say this. Here in Texas, we can. So other states may not. It may be if the clinic's protocol says yes. But MAs, medical assistants can. I'm a MA in California and I do give meds. Yes, ma'am. It's basically all about the clinic's protocol. Oh, in Ohio they can't, but it's the clinic's protocol in some states. We can as well in Virginia. Yeah. And it's the clinic's protocol, right? All right. Uh-oh. So here we go. Y'all ready? I'm gonna turn it back this way. One of my students were going, leaving out the classroom. I guess it depends on each state's scope of practice. Absolutely. And also the comfortability of the provider, right? Bupropion is the medication. 150 milligram tablets. Take 1 tablet by mouth once a day for 14 days, no refills. Create a live schedule, you have more people to join your live. Yes, I do need to create a schedule because sometimes I just randomly go live and I get my students authorization, but I don't show my students. But yes, I have 2 students.
You said Bupropion?
Bupropion. B-U-R. I'm sorry, B-U-P-R-O-P-I-N. Are you asking how to give it? Yes, bam. No, I didn't ask that question. But Joy 73, yes. So I have on these pretty glasses. I like to think they're pretty, but I still can't see. So if I'm trying to, if I butcher your name, I apologize. I only have 213 likes. Tap the screen, y'all. Tap the screen. Bruprofen. 150 milligram tablets. Take 1 tablet by mouth once a day for 14 days, no refills. Bam. And whenever I'm saying bam, they have a paddle. Yes, yes, correct. In the morning, yeah, I normally go at 9:30. You're missing one important statement. I normally go at 9:30 because class starts at 9 o'clock. Yes, basically, yes. Bam. Or they can take it at night. The question was, I didn't indicate with food or when to take it. The reason why I say at night because I was on this medication, but it's okay. Some medications are prescribed for multiple reasons. All right. Now we have a hypertension. What is the term hypertension?
High blood pressure.
High blood pressure. The medication is lisinopril, SIN-IN-OPRIL, lisinopril. Yes.
SININOP.
Yes. PR.
Oh, say it one more time, please.
SIN. No. LIS.
Yeah, those are.
That's what, that's why you look at me like I'm crazy. LISINOPRILL. I made the pronunciation. Yes. I forgot the I forgot the L. LISINOPRILL. I spelled it correctly. I just said it incorrectly. Oh, that's hypertension. Sorry. Lisinopril. I spelled it correctly, but I was spelling it to them incorrect. All right. Listen to the statement. Listen to the statement. 2.5 milligram tablets. Take 1 tablet by mouth once a day for 30 days with 2 refills. How many are you going to, how many you're going to dispense?
How many refills? Can you say that one more time?
Lisinopril is the medication. It's 2.5 milligram tablets. Take 1 tablet by mouth once a day for 30 days with 2 refills. How many are we going to dispense? So you're correct. You're correct. That's how many they're going to dispense off of the prescription itself. But how many are they going to dispense for that one prescription? That one, yes. Is it Ty? Yes, ma'am. Or, it may be Ty for Tyrone. Yeah, sorry.
This or this right here? This 30 or this?
So how many are we going to dispense? This 30.
Not this?
Right.
Okay.
But we're going to say this. But you're going to dispense how many?
Because they haven't got this yet.
Yes, they haven't got the refills yet. Bam. Bam. Yes.
But I thought you said they still give that every month.
Yeah, they're going to receive this every month, but this is how many they're going to dispense on for this one refill. So for that one sheet of paper, that's how many they're going to dispense.
So they're doing that?
Yes. Just like that.
So they're just getting what they're taking.
They getting $130 per prescription. Bam. This one prescription is worth $30. But it has 2 refills. So it's going to say 1 of 2 or 1 of 3. So they already gave 1. And that means they get 2 more refills. Yes.
Okay.
Yes, that means they're going to get 2 more refills. But again, that's how we're writing it. But once it goes over to the pharmacy, the insurance may say, we're going to dispense all 90 at once. Because it's based off insurance how the pharmacy is going to dispense that medication. But this is what the doctor has ordered. Bam. Hey, Miss Allison, how you doing? Yes, 30 per month. Yes. Bam. All right, so here's a dosage calculation. Here's a dosage calculation. Listen to the fluff. The MA is going to administer 150 milligrams. Intramuscular. The label is a multi-dose vial. But it's 100 milligrams per ml. How much would the medical assistant give? The question is, a medical assistant is administering 150 milligrams intramuscular. The label, what we have on hand, is a multi-dose vial. How much is the medical assistant is going to give? I have 2,000 likes. Thank you, guys. Shut your face, yes. Yes. No, so we're going to divide whatever the doctor ordered, 150 milligrams, yes. Shut your face, yes. We have to divide whatever the provider orders. Divide it over what we have on hand. Correct, Ty? Yes. Y'all are correct. Bam. Shut your face. Bam. Bam. Because a syringe is expressed in mLs or cc's. So let me ask you this. You're giving this medication intramuscular. And it's going deltoid, right? Deltoid. What is the angle we giving that medication? 90 degrees. Absolutely. We're giving it, shut your face. Go ahead, Rachel. And y'all know I don't mean to be rude when I say shut your face. It's just that bam, y'all got it. Bam. Last one. Dosage calculation. Dosage calculation. A patient is ordered 0.5 milligrams subcutaneous. Every hour. PRN. We have on hand 2 milligrams per ml. That's what the container says. How much do you give per dose?
What, how much was it you said?
The patient is ordered 0.5 milligrams. If the medication is going to be administered subcutaneous.
Every hour.
Every hour. PRN. What's available on hand is 2 milligrams per ml. That's what the container says. In a 1 vial. It's a multi-use vial, right? How much are you going to give? Shut your face. But okay, so the other two, bam, bam. You missing something. Bam, there you go. You missing something.
Is it 2 or 0.2? I was from the code answer or how it was written for the card.
Bam, bam, bam. But remember, here's the statement. Okay, no, I don't have to say it again. So look at what we have on hand. Look at what we have on hand. Thank you guys. I'm gonna follow you guys back. I'm gonna follow you guys back once the live is over. And thank you guys for liking the live. Thank you. Good morning, Miss Ashley. Thank you for joining. If anybody is in the Houston area looking to take a phlebotomy class, Miss Ashley Phlebotomy School, she has a class starting soon, another class starting soon. If you're looking to take the phlebotomy class, Ashley Phlebotomy School. Yeah. Okay, ma'am.
I don't know the calculator.
Huh? Okay. Remember, it's going subcutaneous. We're gonna administer that. Yeah, bless your little asthmatic heart. It says how
What is
become a. So my school, it's 4 weeks.
Those are like the
4 weeks, because they come Monday, Wednesday, Friday from 9 a.m. till 3 p.m. That's how long the phlebotomy class.
no the 10 to 15
I wish I had you for a teacher. Bless your heart. I get that a lot. I get that a lot. I like to always say I teach this class as if I was taking the class. I learn a little differently, if that makes sense. I have to always, I make this statement to my students, make it make sense. The textbook says pharmacology math. Don't look at it as math, think of it as a formula. How long is the class? Medical assistant is 13 weeks. It's actually 10 weeks in the building. They have to complete 120 hours, which is 3 weeks. You graduated from nursing school, 2 months. I'm excited. I'm excited for you.
Yeah.
I'm excited for you guys. Yes, ma'am, I wish I can take your class also. Oh, you're so sweet. What is the lesson for today? Pharmacology, dosage calculations, and writing out prescriptions. I'm a new MA instructor. Any advice? Absolutely. Here's the advice. Think about every student learning styles. Always picture yourself in their position. I've been teaching for 13 years, right? I look at the young adults. I call them young adults, kids. I look at the young adults as if they were my child. What would I want my child to get from a class? And always have them make flashcards. Make flashcards. I know the textbook from cover to cover. So I will always point out, this is on page 79, the third paragraph, you may want to highlight it. So that's gonna be your saving grace. Because if somebody said, oh, I don't remember we went over that. Let's look back at it. Oh my gosh, I haven't taken that class yet in my MA program. I'm so nervous. Don't be nervous. Think about this pharmacology as a formula. I feel like my school has cheated out. No, don't think like that. Please don't think like that. Unfortunately, a lot of medical assistant instructors aren't well versed. Oh, that was a good statement. Aren't well versed in phlebotomy, pharmacology, nor EKG. So I always I say it on every live, just verify if the medical assistant instructor is certified. How you going to want to teach me to get certified and you not? Because I'm certified in all three. Well, I have 5 certifications. Okay, let me see. Yeah, bam. Bam. I'm sorry, y'all been had it. I'm sitting here talking. And bless your heart. Because I can talk. I can really talk.
How are your kids on there?
It says the instructor was more than certified. She was an RN. I'm at a loss for words. Sorry. I'm just at a loss for words. I would say just study. Look back on some of this. Unfortunately, your teacher was virtual. I'm sorry, I'm just at a loss for words. All right, so now we're gonna go over a review for everything they've learned in the last 3 weeks for medical assistant. Ask for on hand.
I see.
Ask for hands on. Yes, ask for hands on. Or you can always ask them, but ask them nicely. Can you please explain? Make this make sense. All right, let's go over some abbreviations. What are you talking about? Bless your heart.
I said, who might do is that? This one might be my son, but this one. This one might go on in there.
You said this will make what?
This because your name was there, I don't get you. But Darren. The back one is from the mountains of compasses.
LOL. It's crazy. Ask for a patient scenario. Absolutely. Ask for patient scenarios. It says, where are your scrubs from? I own my own scrub line. It's called Scrubs That Fit. It's an online boutique. You should go visit, honey.
Go shop.
Go shop. Today, do you think... Oh, I don't answer corrupt questions. Sorry, sweetie. It says, say the name again. Scrubs That Fit. Because whenever I'm looking for scrubs, I thought of the company name. Whenever I'm looking for scrubs, I needed them to fit. So that was my company. That's when their company name came from. Oh, thank you, sweetie. All right. Let's do a review. We're going to start with, hey, Callie. She said, I'm from Cali. All right, here we go. Y'all can just answer this out loud.
Okay.
When you think of the term diabetes mellitus, what is the first thing that comes to your mind? Diabetes. What's the first statement that comes to your mind? What do you think about when you hear the term diabetes, diabetic?
Pancreas.
Bam. What else?
Insulin.
Shut your face. What else?
Sugar. Lack of.
Bam, bam. Shut your face. Yes. Bam.
What is all? Because diabetes is a lack of insulin.
Bam.
Yeah.
And it's secreted where?
Huh?
In the pancreas, right? Shut your face. Yes. Because when you see the question, just with all those statements, you're going to be like, oh, that's diabetes. A1C. Dang, you ain't got technical with me.
What about FBS?
And yours, who?
FBS.
FBS. What is FBS?
Fasting blood.
Fasting blood sugar. How is it written?
Capital FBS.
Capital FBS.
Glucose.
Bam. I was just going to ask that question. Whenever you think of sugar, you're automatically going to go straight to glucose. And you know what? Look at that. That was my next question. This was my next question. Glucose. So I'm going over the questions. Yes, ma'am. I'm going over the questions that's going to be on their certification review. They take 200 question certification at the end of the 4 weeks. Okay. What vaccine or vaccination does OSHA regulation requires for all healthcare workers?
Hepatitis B.
Hepatitis B. Hep B. Cleaning the venipuncture site using a circular motion, starting with in, working your way outward. What are you going to clean the site with?
Alcohol.
Alcohol. What is the technical medical term? Well, technical term. It's not medical. Thank you. They put a heart on my head. Don't know what that means, but you're so sweet. Thank you.
Antiseptic wipe.
Antiseptic alcohol wipe. And what is another pretty term they use? And I just say pretty term. Oh, that was a glitter badge. Thank you. Yes, antiseptic technique. It is alcohol. It's just 70% isopropyl alcohol.
Oh.
70% isopropyl alcohol.
It has to be 7%, right?
She said, I like the way you teach. Thank you. Thank you so much. Y'all make me feel real good and special. I'm like, go girl. Okay. A small disposable instrument with a sharp point used to puncture the skin. Blank are small disposable instrument.
Lancet?
A lancet. A lancet. It's a lancet. Remember, it's a small and it's a retractable needle. Well, I'm gonna say some lancets has a retractable needle. Give me 1 second. It's a lancet. So here we go. Yes.
Lancet?
A small device to puncture the skin. A abnormal reduction in the number of red blood cells is what? An abnormal reduction. Reduction. Red blood cells. I understand where you're going, Miss Kathy Flawless, but give me some more. I know where you're going with it. Give me 1 minute, let me go to the restroom. A abnormal reduction in the number of red blood cells. Abnormal red blood cells is your aha moment out of that question. Yes, shut your face.
What she said?
Bam. This nut said, what did she say? And you know, I tell them all the time, shut your face. She said, what she say? Abnormal reduction. Reduction. Abnormal.
What y'all say? Goes in the comments. What's the answer? Tell us right now. Tell us you
I don't remember.
scrubs.
I don't remember talking about a reduction in red blood cells.
I know red blood cells are RBC.
Yeah, RBC erythrocytes.
You have a reduction? That's where the blood like.
Yeah, she said abnormal reduction.
That's for a
Cool.
Where is what?
It's my spots.
I am confused. I am confused.
Everyone just tell us what the answer
Right.
is. Please.
That's what I do for this book. What is that? We're not sure. Yeah.
So think about a condition.
Mm-hmm.
A blood condition. Oh,
Give it to me, girlfriend.
it's because anemia is blood condition.
Emia's blood condition.
Anemia.
Shut your face, yes. Stop second guessing yourself.
Anemia.
Oh,
Anemia.
because
Wow, are you?
You use that because you lose the iron. You don't have that much iron in your blood.
Exactly.
Which
Bam,
is-
shut your face.
Hemoglobin. No. Yes, it is. It's iron.
Iron is in hemoglobin. Yes, ma'am. Go ahead, girlfriend. She says I'm a Spanish speaking medical interpreter.
Period.
Period. She said period, girlfriend. It says, what are the qualifications for this course? Your body and time. That's it. That's it. Dedicate the time. Hey, Miss Cynthia, thank you for joining. You had the best name ever. My name's Cynthia. They looking like, yeah, right. Okay, here we go. Safety conditions ensured by the employer and mandated by law is under what? Safe working conditions. The rest of it is fluff. Safe working conditions. The rest of it is fluff. And the medication aid and assisted living. Yes. Miss Toya. Bam. You're a medication aid, so I take it yes. But it's something about that, Miss Keisha, see. It's something about that, oh, I'm sorry. Amelia, you're right, but what is it? Fix it. Sorry, I got a phone call, missed it. Bam, shut your face, yes. It's a safe working condition. Safe working condition. What was you saying earlier?
We said OSHA.
Oh, y'all did say it. I'm sorry, it is OSHA. How is it written?
OSHA.
OSHA, how is it written when you write it? Capitalized.
All of them.
All letters capitalized. But yes, you guys were right. It's just capitalization. Because some of the questions on the certification, they try to trick you up, right? Some letters may be capital. It may be a combination of the two. But it's all capitalized. So can I take this course? If you're in Austin, Texas, you can. Because unfortunately, I don't have a remote class. All right, here we go.
Yeah, you should have OSHA.
So I'm gonna switch this question up.
This is old. These are old.
What would cause lab results unreliable if the specimens are collected? What would cause? What would cause a unreliable if the specimen is collected with what?
Alcohol.
Bam. Indigestion of alcohol. And or you can't prep a site with alcohol for alcohol blood test. You don't want a false positive. So here we go. When drawing a blood, that was the next question. The temperature of the centrifuge should be check when?
Every morning.
Bam. Or the start of a shift every morning, right? Because What if they lab? All right, what is the abbreviation? Capital C, capital S, capital F.
Congestive. Oh, capital C, capital S.
Capital C, capital S, capital F. Charlie, Sam, Frank. CSF. Mm-hmm.
Spinal fluid.
Cerebral spinal fluid.
These are old.
Oh.
She's like, what? Cerebral spinal fluid. I'm sorry, I have a call coming in. You guys, give me 1 minute. Give me 1 minute. I apologize. I just had to answer that call. But I'm so sorry. It's CSF, cerebral spinal fluid. And you guys, please forgive me because I made some of my letters may sound like other letters. Blame it on I'm from Chicago. Yes, I know I wasn't paying attention. Okay, bam. That's okay. Child, that's okay. You probably heard my letters come out backwards. Okay, now I'm not answering this one. Sorry, you guys. Okay. The urinary system is composed of what? The urinary system is composed of what?
Bladder.
Yes? Yes?
And then you.
Yes?
So bladder, uterus, and cervix.
Yes, and one more. One more, Miss Samantha.
There's one more. Urethra.
Yes.
Urethra.
I thought that was the police.
They've been everywhere, Nicole.
I'm scared coming down here.
In Williamson County. Yes, ma'am.
Urethra, she said urethra.
I said yes.
Oh.
Which of the following fluid is extracted from joint cavity? From joints.
You said a fluid?
Yes, it's extracted from. Shut your face. Shut your face. Go, girl and gentlemen. Bam.
I'm gonna say bone marrow.
Go ahead. Shut y'all face. Go, people.
I feel like this was a test.
It's like I'm running 2 classes at once.
I said, I feel like it was in
What?
I said, I feel like it was in the textbook.
Well, yeah, it was in that textbook. Bless her heart. She said, I feel like it was in that textbook. Hey, Miss Jones. Hey. Who is that?
I don't remember what.
Hey, girl, Korean.
Joint fluid.
Wait, you was on my live last night, right? Tisha. Hey, Miss Tisha. I have always tried to think. It's no view. Can't find my scrub line? Scrubsthatfit.com. Scrubsthatfit.com.
You could pin it.
I don't know how to pin it. How do I type it in? Because I don't see the little thing down there to type it in. It's scrubsthatfit.com. Tisha, can you write it in? How long is my program? The medical assistant program is 13 weeks, 10 weeks in the building, and 3 weeks, 120 hours externship, where they go practice their skills at a real clinic, basically. I have one program, 3 certifications. They earn 3 certifications in 13 weeks.
No, this is the medical assistant.
No, I don't have the one piece. I was thinking about ordering those because I need to place a new order now that their New Year's is over. It says what? I meant. Sorry. Synovial fluid.
Synovial?
Mm-hmm. Yes, ma'am. She said, okay, I got it. Thank you. Can you pin it in there for me, Miss Rachel Smith? The principal, nope. The pituitary glands is also known as what?
The master gland.
The master glands. You need credits for public speaking to take the medical assistant class? If that was the case, I would have never. Because my speaking, yes ma'am,
Oh, synovial.
synovial fluid, yes ma'am. Okay. If a patient starts bleeding heavily, what would you do?
Apply pressure.
Apply pressure.
With the gauze.
Why do I feel like this phlebotomy?
Yeah.
This medical assistant?
Yeah, I was gonna tell you that, but I'm sorry, that's just not.
So you're gonna keep letting me go?
Well, yeah, because it's practice for us, but you know.
This is phlebotomy.
Is this for tomorrow's class?
Yes?
That's why I was like, synovial.
Yeah. Oh, I ain't heard that in a while.
In a while, huh? Bam. So answer this question though. If a patient starts bleeding heavily, what should you do?
We said apply pressure.
Oh, you did say apply pressure. I'm sorry. I'm sorry. I had the wrong flashcards out. What did she say?
It's because you're on the phone.
Shut your face, and you probably right. I'm sitting there talking to him more than I'm talking to you. Shut your whole face up. You're right. I'm sorry.
You're too funny, girl. What's the fun with you? Oh, so these are flashcards for tomorrow phlebotomy.
Wait, did you end up putting those flashcards back
I
in? that we
did
used?
put him in the wrong one.
Or are those?
Remember those we used last time?
Because this is phlebotomy. So those are phlebotomy stacks. Yes.
No, you put it in the wrong box?
Yep.
Okay, but I remember this is gonna be the fluid for tomorrow.
Yep. How did I do that? Bam. Shake your face. Okay, bless your heart. Now y'all have to listen to me actually go over the medical assistant because that was phlebotomy. But the great thing about it, phlebotomy is in the medical assistant program. We're going to start off with week 2. Congratulations, you will be a awesome. Love being a nurse. Yes. So here we go. Medicare pays out how much percent? Medicare pays out how much percent? Percent. How much do Medicare pays out or pays for a doctor's visit? Medicare. Yeah, you do. And once I tell you, you're going to be like, child, yes, I do. You're going to remember it. And I apologize again. That was phlebotomy. I had them in the wrong box. Bam, shut your face, yes ma'am. But the good thing about it again is this class takes, phlebotomy is rolled up in medical assistant. I want to be a nurse. You can be it, you can do it. I'm a home health nurse.
You said Medicaid or Medicare?
Medicare. How much Medicare pays out? And or pays for the visit. But if they have a secondary insurance, the secondary insurance will pick up the rest that Medicare doesn't pay out. Thank you guys for following. I'm gonna follow you guys once I get off the live.
80%.
Bam, I do believe. I'm with you on that, Miss Samantha Smith, because it doesn't make sense. Congratulations. I'm a new grad in the ER. Oh, bless your heart. I started the CNA, LVN, RN. I started as a, now see, those are not saying no one else. But, yeah, never mind. I'll keep it to myself. There is a school who just recently, bam, offered for free. All right, go ahead. You guys better ask her what state and city she in. They offer it for free. 80%. It pays out 80%. It should be 100%. I do agree.
No.
Huh?
I said we should. It should be.
Yeah, it should be 100%.
For everybody.
For everybody. Well,
Free healthcare.
a listing of specific service rendered and fees charged is what? Whenever you go to the doctor's office, not an explanation of benefits. Not an explanation of benefits. A listing of specific service rendered. And the fees charged are what? No, so close. I know where you're going with that. No. She just said the same thing.
What did you say?
Someone says first letter. Sorry, I was talking to them. She said, Love child, correct. Not so much. I know where you're going with that, but yes. A list of specific service rendered and fees charged. A list. Bam, there you go. Yes. So think about this. It's a list. Mm-hmm. They created an Excel spreadsheet where there's a list of the services that they rendered. They gave to a list of patients. and the fees associated with that service. They give you an outline. They break it down. This spreadsheet has 3 columns. The patient, their chief complaint, and how much for that chief complaint. You thinking about it too hard. Let's look at our Walmart receipt. Here's a hint. It's a breakdown. The Excel spreadsheet, everybody has its own line item. You thinking about it too hard?
Receipt.
Bam, come on, give it to me. Okay, Angela, you're not gonna say that no more. If you say that again, I'm gonna make you stand. Look like you in my class. Child, you are. These just questions that make you think, like, shut your face, what is that?
Just did it yesterday.
It's all about critical thinking. Break down the question. If you saw the question, you just want to break it down and you got it. I love that statement, critical thinking. Critical thinking. A list.
A receipt of conduct.
Yep, here's your Walmart
Oh, it's for
receipt. Huh?
I got it right.
No, so close though. Your Walmart receipt. Every item you purchase has a line item. It's the SKU number. It's the description of the Premier Protein coffee. And then it has a dollar amount associated with what I purchased. The SKU number, the part number from the barcode. Now it says here, it was the Premier Protein 12-pack. If y'all interested on my, just purchase, buy me something. And it has a dollar amount associated with it. It breaks it down. Your receipt broke down the items. Every line item. So I'm going to say this. Nurse_cry may need to answer this question. That is not my strong suit. And here's the statement. I'm a medical assistant. I'm not an RN, I'm not an LVN. Not saying anything bad about a medical assistant, right? But I don't know. And I'll be the first to tell you, if I don't know something, I don't know. Because I'm not finna say it and then y'all eat me up in his comments. But nurse_cry may be the best person to help you with that question. Look, nurse_cry, shoots, I done volunteered you, huh? Learn the droid classes first. Learn the top 200. See, I would never, bless your heart. My daughter just started.
I don't know.
She is on my blood pressure. Uh-oh.
Like I know what I do.
It's an itemized statement. The items are itemized. That was chapter 9. That was chapter 9.
Just in chapter 9.
Thank you, guys. I say that some of these are the best platforms ever because you never know who know somebody that knows somebody. Or they may know the information, right? But I'm not too big to say, listen, I'm not a SME on that. And SME is just a subject matter expert. I stay in my lane. I'm not saying that it's out of my lane, but I don't know.
It says remittance advice statement. It
Ah.
says-
A rendered advice, what? That's the explanation of benefits. We're talking about an itemized statement.
That's voted. It says both forms include the same information. The EOB and RA list the dates of service and charges that have been billed.
Same. Where's my textbook? Yes. Bam.
Where's that voted?
Co-insurance, deductible. Yes. No. It says there are tiers performed. Group policy.
What is that, a 10? One thing about Shadow Tennis to look. That's zero direct.
Yes. Sorry. The account statement and the bill, yes. Cash payments, no, report. It says bad debt. Accounts payable, accounts receivable. Liabilities. Purchase order. Invoice. Shit. Oops, you know how much. Agent report, no, it's 60 days. Outstanding balance ledger. Sliding scale, yes. Fees never deducted in writing. Patient discount. Give me a minute, let me look.
So that is how the form looks, right?
Yes, that is exactly how the form
So
looks.
it's in here, it's just not worded on.
I apologize, you guys. I was trying to locate it in the textbook. Because there's the ledger.
It has the same on here, just not worded.
Private healthcare insurance fraud deductible. So give me a minute. Let's put that one in the parking lot. I'll come back and get that one. Oh, y'all talking about medication. What happens on January 31st from your employer? It's mandatory that they do what? I'm not going to ask the question because you already know the answer. I just flipped it over, asked the answer, and then you give me the question. On January 31st, your employer must do what? Bam. On January 31st, it's mandatory your employer must have this postmarked by January 31st. Your employer must have this sent out, postmarked, post dated by January 31st. I got mine before January 31st. But I'm gonna wait till the last date because I'm scared. Yes, your W-2s. Y'all think about this stuff too hard. Y'all gonna stand up, keep it up. Which of the following groups sponsors TRICARE? TRICARE is what type of insurance, ma'am?
Military, yeah.
Military. And it's also what? TRICARE, Medicare, and Medicaid.
Medicaid, Medicare,
And
is,
TRICARE.
TRICARE is for military, Medicaid is for people with low incomes, disabilities, Medicare for people who are 65 and older.
Shut your face. Okay, so all those is lumped under what category?
Health
Bam.
insurance?
It is health insurance. Shut your face. What type of health insurance?
Oh.
And I don't abuse them, so sorry. I just tell them to shut their face a lot. Bam.
Private? No. Private health insurance?
Medicare, Medicaid, and TRICARE. Privates are HMO, PPO, Humana.
You talking about the color chart? The bronze, silver, that?
No. Medicare, Medicaid, and TRICARE. They all fit under what category? Bam.
Max? Yes.
No. Bam.
Government funded insurance?
It's government insurance.
Good.
It's sponsored by the federal government. State funded. It's the federal. It's federal. But each state is Medicare, right? A patient who is 68 years of old or 68 years old is most likely covered under what?
Medicare.
Medicare. Listen to the question. The predetermined amount of money paid by the patient before insurance kick in is called what? A predetermined amount. You have to pay this.
Deductible?
Deductible. Shut your face. Under what program may retired military and their dependents or active military personnel receive? Who? Listen to the statement. Under what program may retired military or their dependents or active military personnel receive?
Champ.
Bless your heart. Shut your
it's
face.
right here.
Yeah, thank you. United States healthcare system relies heavily on what?
Private healthcare?
Private. So here's the question. An insurance contract written for a company for their employers are what? Insurance contract written for the employer to offer to their employees, actually. To offer to their employees. Multiple employees. It's a written contract. Thank you so much. You have a great day. Thank you for joining us. Yes. All right, Sierra. Thank you, guys. Good morning, Ms. Jordan. An insurance contract written for the company. So HMO went over to Taco Bell and says, hey, look, here's a contract to offer your employees insurance. Employees, multiple, not just one. And again, once you see the options, you already know. You already know the answer to these questions. So what I'm doing is I'm giving you the answer, now you give me the question, or vice versa. I'm giving you the questions, you give me the answer. It's a whole lot of fluff. An insurance contract, insurance, written for a company, for their employees. Insurance, company, employees means multiple. They lumping them up as a what? Yes, say it. Bam.
Group coverage.
Group coverage. The question is, in insurance contract, insurance is your aha moment, written for the company, aha moment, for their employees, a group of people. What is the name of the insurance? The name of the insurance for work-related injuries.
Workers' comp.
Workers' comp. That's all they have pulled out for aha moments in week 2 chapters. Now we're going back over to chapter 1. Forceps is the type of what?
It's a type of instrument that clamps on tissue during a procedure.
Shut your face. Yes, hemostats as well. But they are for clamping. Sorry, I'm being nosy. Leukocytes refers to what?
White blood cells.
White blood cells. How is white blood cells written?
Capital WBC.
Capital W, capital BC. Lying flat on their back.
Supine position.
Bam. The word part for peri is what?
What?
The word part for peri, P-E-R-I.
Peri is around.
Around. It says, listen to this. During an eye exam, what instructions are you going to give the patient? During an eye exam.
To cover their left or right, cover one eye while both eyes are open.
Cover one eye while both eyes are still open. And we're going to document the opposite eye. That's reading, right? Mm-hmm. So what is the name of the vision chart? Y'all give me the name of the vision chart. Snellen. Now let's document the reading for the Snellen chart. I'm sorry, the vision acuity. Right eye is who?
OD.
Left eye is who?
OS.
OS. OD, OS. Snellen. S-E-N. Yep. I'm sorry, S-N and Ellen. Snellen. Stop laughing. Shut your face. They laugh at everything I say like it's a joke, and I be darn serious. Algia stands for what?
Pain.
Pain. The first sound heard when taking a blood pressure is called who?
Contraction phase.
The contraction phase or
Systolic.
systolic. Bradycardium refers to what?
Slow heart rate.
Palpating is done what procedure?
It's
Palpating.
feeling of body parts.
Yes. Mm-hmm. When a small sample of tissue is taken from the body and sent to the clinical laboratory to be examined or studied, it's called who?
Biopsy.
A biopsy. And just a whole lot of fluff. That's all it is. A whole lot of fluff. The abbreviations for 3 times a day.
TID.
TID. How is it written? Bam.
Capital T, lowercase I, lowercase d.
Shut your face. Yes. Go ahead. Do it, y'all. I know that's right.
I need to see her read.
The most common vowel is what?
Oh.
O.
Oh, vowel.
Vowel. Don't try to knock my pronunciation.
I answered the question correctly, and I was like, the what?
She said.
And I was about to
what?
ask you if you could repeat the question, but she had said the answer.
The abbreviation for 4 times a day is who?
QID.
QID. Quad, right? Like the quad skates. They're 4 wheels. You already answered that one. Bam. The opposite of distal.
Proximal.
Proximal. Tissue is comprised of what?
Cells.
Cells. What is the abbreviation for cells and or the word part for cells?
Site.
Site. Is it a prefix or a suffix?
Suffix.
A suffix. Suffix is located where?
At the end.
Where's prefix located?
At the beginning.
Bam. The opposite of ventricle is what? Chapter 6, where the man is standing here, the anatomic positions. Ventricles is located where? Or what position is ventricle? I guess that's the right way to say it. Thank you guys for joining. We're going over medical assistant. I teach the medical assistant class.
Sorry.
I teach the medical assistant class. Fast track is a one program. They earn 3 certifications in 13 weeks. There's 10 weeks in the building. They have to complete 120 hours. Roughly 3 weeks. They complete, shut your face. Yes, ma'am. I'm a medical assistant. Go ahead. What state are you located in? Are you certified as a medical assistant? And I don't mean that disrespectful. No, not at all. Because most states don't. Bam. Houston, and yes, she said yes. You in Houston? I'm in Austin. Well, I'm in Round Rock, right outside of Austin. I'm scared of Houston. I'm scared of the drive. I don't do overpass. You graduated last year? All right. All right. Who you going to school for? Oh, good night. All right. I am in Houston, but not certified.
It's anatomical?
It's the anatomical position, but what was the question?
What was the opposite of?
Ventricle. You're not certified. All right, we need to fix that, Miss Samantha. We need to fix that.
This was anatomical or they're fixing it.
Yes, it is anatomical position. Oh, you in San Antonio? Go ahead.
No, that's what I was telling you.
It says graduate. Oh, you graduate this April with a medical assistant and phlebotomy San Antonio? I know that's right. If anyone is in San Antonio, drop the name of the school you attend. The opposite of ventricle. Ventricle is located which position?
It's not anatomical?
No, anatomical is the position. Right. So
Oh.
if you're standing anatomically,
Uh-huh.
where's ventricle? No, that's transverse. What chapter was it? Is it 8?
No.
No? Is it 12?
It's 12?
It is 12. Bless y'all, the asthmatic part. It's 12. Ventricle is located, pointing which direction? Graduate in April as a phlebotomist and? Oh, BSN? Go ahead. This is a helpful review. Thank you. You went to CHCP? I used to teach over at CHCP.
To the front of the body?
Yep, ventricle is in the front, so what's the opposite? Yep, I used to teach over at Yep, dorsal. At CHCP, I taught there for 3 years. Best school ever? Oh, well, okay. Best school ever. All right, here we go. Osteo means who? Bam. The ventricle of the heart. But I saw that and I didn't want to say anything, but you're right. Bam, you got this, sweetie. The school I go to is who happened? Restore education. Bam. Restore education. Clamping of small vessels. The clamping of small vessels. Put that down. You just said it. That was the third question you just answered. They just asked the question multiple times. Bam, that's it.
Oh, I thought there was a different word for
It's
vessel.
hemostat and forceps. No, it didn't say the medical terminology for. So there, some of these questions are it's the same answer but worded differently. That's all it is. High blood pressure refers to who?
Hypertension.
Hypertension. A normal temperature in Fahrenheit is who?
96. 98.6.
98.6. What is a normal temperature in Celsius?
37.
37. Y'all just answer this, the anatomic position. Where's the carotid pulse located? Carotid. In the neck. The abbreviation for blood pressure?
B,
Capital B, capital P, and or.
B/P capitalized.
B, capitalized B/P. The most common artery to take a pulse?
Radio.
Radial. Nursing school. I love it when these videos pop up. Always a good refresher. Thank you. Thank you, thank you, thank you. What's she saying?
We were talking about the insurance. We were saying, we hope we don't have to deal with insurance.
That's why you say, what are you here for?
Insurance. Let me go get someone else for you.
Oh, I gotta use the restroom, but she real good.
I'm on the top.
The suffix is located where in the word? Thank you guys. At the end of the word, the abbreviation for every 2 hours is who? Every 2 hours.
Q2H.
Q2H. The abbreviation for hour or hours?
Capital H.
Bam.
Every hour or just hour?
Every hour.
Every hour is QH.
Bam. The patient with a rapid pulse is what? Is categorized as what? Okay, see y'all later. Thank you, sweetie, for joining, Miss Toya B. Thank you for joining. Thank you for staying here so long. Listen to me talk. Bless your heart. Bam.
You said with a fast heart rate?
It says a patient with a rapid pulse.
Oh.
They tried to trip you up and say rapid. Rapid means what? Bam. Tachycardia. Shut your face. Oscillation is done by using what? A stethoscope. If a patient is laying face down is what?
Prone position.
Prone position. Watching a patient rise and fall is you're monitoring what? Respiration. The abbreviation for immediately is who?
Stat.
How is it written?
STAT capitalized.
Bam. You already know that. I already asked you that. Hypertension also refers to what?
High blood pressure.
High blood pressure. All right, we're on week 3. My students are on week 3 of 10. We're covering medical assistant. Earlier, we covered phlebotomy, but shouldn't have. Week 3, we're on week 3 now. Bye, y'all. Have a good day, Miss Samantha. Thank you for joining. If you haven't followed, follow me. Under the Controlled Substance Act, how many schedules are there? We're going to go over chapter 26 now. But we read it already, right? Nope. Intermuscular
90 degrees.
is 90 degrees. It's 90 degrees. Where's another site for giving oh no, we didn't go over that one. We're going over that one today. They already know how to draw up the medication. I have them drawing up the medication in pharmacology before we review the chapter. So I'm just going over some they already know. Subcutaneous is given at what degrees?
45.
45 degrees. What are the 3 common injection sites? Bam.
Your arm. Oh, it's sites?
Yeah. 3 common injection sites. So it's normally given at a 90 degrees if they're injecting insulin. But it is, yes. Shut your face, yes. So that's one. And yes, give me the rest. Shut your face. Now give me all three.
Intramuscular, intradermal, and subcutaneous.
Subcutaneous, yes. Intramuscular, intradermal, and subcutaneous. What is the common reason for giving an intradermal injection?
Skin allergy test.
Allergy testing. Shut your face. Yes, girlfriend. A medical assistant should only give medications when? Think about the answer. A medical assistant should only give medications when?
When the doctor orders.
Yes, bam, shut your face. The doctor got to say, yes, this patient is eligible for. Unless it's what? Unless it's what? You're right. Miss Emily.
Like it's like a predetermined permission.
Predetermined permission is also known as what? So it is, we only give injections and or medications whenever the provider orders it. Unless when? Unless what? What would the provider say? Shut your face. Love child. Yes, ma'am. And I'm sorry, I'm just really hyper when I teach, so I may be pointing. Shut your face. It's so close. Come on. Give it to me. I'm just really animated. So when I say shut your face, I don't mean at the back. Bam, standing order. A standing order. So give me an example of a standing order. No, we just went over it last Thursday. I just gave you that information when we were rooming the patient. Thank you. Thank you, thank you. And you know, I do say shut your face to my students, but what happens is I can say shut your face to this one. I can say shut your face to both of them, but some I just know their personalities, and I would never be able to say that because I don't want them to feel as if I'm being mean. Does that make sense? Like these two right here. I could say if you don't stop second guessing yourself, you're going to stand up. And guess what? They had to second guess themselves since then. But I'm not being mean. Mm-mm. Give me an example of a standing order.
A doctor is saying to give people flu shots.
Huh?
Flu injection.
Bam. She said example is a flu shot. We don't give shots. We give injections. You get a shot at the bar. We don't give shots. Bam. I'm bypassing the rest of these because we're going to go over it now in our chapter. So I didn't ask them those questions, if that makes sense. So now we're going to go to rooming the patient. I bet you are so good. Thank you. And you know what? I need to take screenshots of some of y'all responses because my daughter don't think so. Number one, she don't think I'm TikTok famous. I just call myself TikTok famous, if that makes sense. And this one here looking at me like I'm an alien. Yes, I said it. I ain't TikTok famous. Only got 2,000 followers. But as soon as I got one follower, I was like, oh, I'm famous.
Can I see your week 2 flashcard?
Oh, yes, ma'am.
Thank you.
I just gave you that so we can keep it together. All right. So let's talk about rooming a patient. Let's talk about rooming a patient. Whenever you have the triage page for the patient, whether it's an EMR, thank you guys for joining. She said bye. Thank you. Or whether you have a paper triage page. When collecting or picking up your patient from the lobby, what is the best technique? Bam. I'm sitting in the lobby. Mm-hmm. I'm your 11:15 patient. Mm-hmm. Is it 11:15? It's 11:08. Why is that one fast? What is the best technique for rooming your patient that's sitting in the lobby?
To call their first name. To get confirmation.
To call their first name and confirm. If you call my first name Cynthia, I'm gonna say yes, ma'am. My name is first name, last name. I'll be your medical assistant, right? Mm-hmm. Now, when you get them so far back outside of the earshot of the rest of the lobby, now what else are you gonna confirm?
Their date of birth and last name.
Last name and date of birth. Because there could be 3 Cynthias sitting out there, right? Mm-hmm. Or some may go by Cindy, but my preferred name is Cynthia, but her preferred name is Cindy. I'm located in Austin, right outside. Verify their date of birth? Yes. I'm right outside of Austin in Round Rock, Texas. All right. So you have your patient. You escort them to the exam room, right? So now let's interview the patient. I call it interview. Now let's interview the patient. The chief complaint is left ear pain. The chief complaint is left ear pain. Now interview them about the chief complaint.
Ask them how long have they been having ear pain?
How long have you been experiencing pain? Now what else?
It's rated from a scale of 1 to 10.
On a scale of 0 to 10 or 1 to 10, what's your pain level today? You have to make sure you ask them today, because now you're going to go down a whole rabbit hole. Well, on Sunday, it was a 10. Then on Wednesday, it subsided. But today, I just want you to take my whole eardrum off. Bam, bam. Okay. Because, yeah, all that can be associated with it, right? All right. Now, I have the chief complaint is left ear pain. You ask how long have you been experiencing pain, and then on a scale, shut your face. Have you been taking anything for it? Because we don't want the provider to say, okay, let's give them this. And they already taken something for it, right? All right. Now, we're going to ask them the important questions. What's next?
Are they allergic to any medication?
Do you have any allergies or sensitivity to medication? No, I don't have any allergies or sensitivity. How are you going to document that?
NKDA. No drug allergy.
NKDA, no known drug allergies. All right. I have no known drug allergies. Now what's the next statement? What? Because we interviewing the patient, right? Mm-hmm. I have no known drug allergies. What's next?
Confirm their pharmacy.
Confirm the pharmacy. Why not stick with the pharmacy I have on file?
Because they could have moved.
They could have moved since the last visit. Or the doctor's office or the urgent care is closer to work, right? Mm-hmm. But I want to pick it up during my lunch hour. So I need you to send it over to the pharmacy that's across the street from my job. We don't remove the original. We just add this new one.
For convenience.
For convenience. Shut your face. All right? We have their allergies. The pharmacy. What's next?
If they have a uterus, ask them their last menstrual cycle.
Yes, if it's a female. Yes, never mind. If it's a female, we're going to ask them, when was your last LMP?
And are they on birth control?
And are you taking any contraception?
And then we ask them if they're currently on any medication.
Are you currently taking any medication? Now what's next?
You signed yes, initial
Yeah.
time and date.
So I have them initial time and date after they ask those questions, because when they're EMR, it timestamps it. That's why I have them initial and signature. Okay.
Before all that, we're taking height and weight.
Now you're going to take vitals. Before all of that, it all depends on where the scale is, right?
Right.
Because some patients will say, I'm not getting on that scale. If they don't want to get on the scale, what's going to happen? What are you going to do?
We'd have to tell our provider.
Notify the provider. And 9 times out of 10, that provider going to go in and say, you need to get on the scale. And then the doctor going to say, oh, she's ready for the weight. I'm like, you should have just did it when I was in there. All right. So, but the patient could say, oh, I'm 198 pounds. Don't judge me. If they can say I'm 198 pounds, how you gonna document that? PI, patient indicated. Patient indicated. Because we have to make sure they know, the provider, know that I didn't physically take a weight. Patient indicated it. All right. And they may not want their weight taken for multiple reasons, right? I'm just being ugly. I'm just acting out. It could be some underlying issues. Maybe any eating disorders. They just don't want their weight taken. But if you have to take their weight, make sure that you don't write it on a triage page. So in the event you put it down and they see it, we can have them turn their back towards the number screen and then still take their weight. But do not jot it down so they can see it. All right? They lie. Sometimes they do, unfortunately. Sometimes they don't tell the whole truth. But me, I'm telling you, I'm like, listen, I got an extra pound of groceries on me. Thank you. It's a butterfly, look. Okay. Oh, look. It's a stethoscope. Sorry, I'm showing them my tattoos. Sorry. Okay. Now, we have them in a room. We have their height and weight. Now what's next?
Check the blood pressure.
Check blood pressure. Now we have to be careful with the blood pressure because some clinics will say make that the last vital you take. Make blood pressure the last vital you take. Why? Why do you think so? Why do you guys think that some clinics say blood pressure is the last vital you take? Thank you for the knowledge.
So they can settle.
I am recovering in the ED. Oh, I'm praying for a speedy recovery. Oh, why do you say?
So they can settle.
So they can calm their nerves, so they can be relaxed, right? Because a lot of patients have what they call white coat syndrome. They're nervous about being there, and then it may be elevated because of the ear pain. So it may, because pain will fluctuate your blood pressure. All right. So now we have the height and weight. Technically, we have the blood pressure. Since you said it, now what's next?
Heart rate and pulse.
Heart rate is same as pulse.
Yeah, sorry.
Bam.
Heart rate and respiration.
Heart rate and respiration. But what are we going to document? What's important about the blood pressure?
To indicate which one.
Indicate which arm. Bam. We have to make sure we indicate which arm. Yes. So now we're going to check the respiration. What technique would you use to checking the respiration?
As if you're checking for another pulse.
Act as if you're checking another pulse. And my thought is when you're checking their respiration, we're looking for their chest to rise and fall, right? I say start their breathing pattern and count. Instead of looking at them all weirdly. We're like, would you breathe normally? But we're never going to tell a patient we're checking their respiration, right? Of course, we're going to get their temperature. When do you get a pulse ox? Check their oxygen level.
If it's
respiratory.
Anything upper respiratory. Now, some clinics will say, but again, remember, it's all about the clinic's protocol. It's whatever the doctor likes, how he wants his clinic ran. All right? Last statement. Oh, I should have did a giveaway, shouldn't I? I have 144 people. Thank you, guys. I should have did a giveaway. Remember, I have to go up to the school.
What time?
She go to lunch at 11:55. As the protocol, you're right. Because every clinic have their own protocol. Thank you guys for following. And it's right there on the street, but I have to go. So I may go back live. Oh, I'm at 6,000. Okay. So last question. Let's write it down here because I want them to answer. You guys have to answer the question. Yeah, write it on your paddle. Go ahead. Yes. Get that education. Here's the question. Give me the 5 patient rights. Give me the 5 patient rights. 5 patient rights. When giving medication and or injections. Bam. Quick question. When you indicated the arm over blood pressure, do you? Yes. Not so much user 1109X. I'm in health science class. Go ahead. Oh, no. You're right. Who is this? Emily. Uh-oh. I'm located in Austin, a city right outside of Austin, Texas. Who is this? I have on these glasses and I still can't see. TikTok. Pal? Huh?
Squinting with my
So
glasses
that's so relatable.
You're so relatable. And I'm sorry, I know y'all getting seasick because I gotta turn it up so I can see. All right. What is it? The 5 patient rights. Bam, let me see it.
There's 2 I can see.
Okay.
I'm trying to remember.
Now here we go. Remember, we're writing the blood pressure as a fraction, right?
Oh.
Yes and no. Preferred arm when giving medication, or preferred arm with the 5 patient rights? Am I located? If I'm not answering you guys' questions, I apologize. They coming down so quickly. So remember, feel free to message her. Yes. Oh, thank you, TikTok niece. Jamie is my TikTok niece. I forgot to message you too that I was going live. I'm sorry. So, all right. So remember, a blood pressure is written as a fraction. 120 over 80. Now you took the blood pressure in the right arm. R with a circle. R with a circle. Do you need a mod? Normally, Jamie would be my mod, my TikTok niece. But I'm finna log out here pretty soon. I have an appointment at 11:55. So class will be over at 11. They going to lunch. Not yet, not class. But you guys. Bam. So whenever I like to think of different acronyms to help my students remember, right? Not saying that they can't remember, but to help them remember certain things. So when we talk about the 5 patient rights, think about PDART. 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 I'm waiting to take my in class. I wish you all the luck. All the luck. All right, so think about PDART. Right patient, right drug, right amount, right route, and right time. 5 patient rights. Yes, I know they added a new right documentation. But whenever we are administering vaccines, 5 patient rights. You need the right patient to get a medication. You need the right drug. You need to make sure you have the right amount. Right route. Where are we giving it? Right drug or dosage. She said, hold on, Keller. Don't say that again on here. They're going to eat you up. Right route and right time. Right route and right time. This is the most I've ever had join the live. Some will watch the live without clicking on it to join it.
Okay.
But
You
then,
can tell people do that.
huh?
You can tell people do that.
So what happens is when it ends, it tells me how many viewers. But the people who joined, who tapped on, is 220. Thank you guys. Oh, I'm famous. See? Say it again.
She famous, y'all.
I'm famous, y'all. Hello, Queen. Okay, so here we go. I have a appointment at 11:55. At 2:22 p.m., I have an announcement based off of my meeting. So if you guys aren't following me, please, please, please follow me. You really ain't gotta follow me. But just remember, at 2:22 p.m. Central Standard Time, I'm going to make an announcement. Even if you just put on your calendar. At 2:22 p.m. Central Standard Time, I have an announcement. Look, at 2:22, I'm making an announcement. So if you guys can, if you're not following, just set your timer for 2:22. Peter, yes ma'am. Just set your timer for 2:22 to come back on my page. Either the Scrub page, Scrubs That Fit, or Healthcare Career Academy's page. I'm gonna make an announcement at 2:22 p.m. All right, you guys, I have a meeting I have to get to. Thank you guys for joining my class. If you guys like this content, I just learned how to say that. If you guys like this content, if you can Google my company, Healthcare Career Academy in Google. I'm in Round Rock, Texas. If you guys can leave me a Google review. Healthcare Career Academy. Oh, wait a minute. I can't leave yet. I just got 3 roses. Y'all are so sweet. Thank you. Thank you for the roses. I keep hearing that. Yes, when a lady. Oh, shut your face. Oh, I got 3. I meant 2 more. Maybe I shouldn't log off yet, huh? But I do need you guys to come back on my page at 2:22 p.m. Central Standard Time for the announcement. Thank you guys for joining me again. Y'all have a great rest of your day. Thank you, Miss Sarah. I may not go nowhere. Y'all are so sweet. They showing me love. They tapping the screen. Yeah, they some nuts. They going to lunch. I think they both drank an energy drink today.
I'm sorry.
Hi, I will be asleep. Oh, you work nights? Oh, bless your heart. And you still up? Oh, thank you. Thank you for staying, though, and listening to me talk. And that's the sad thing about it. I can really talk. These two are some nuts. You would think they've known each other since kindergarten. All right, you guys, I'm going to follow you guys back. I need to go off on my appointment. If you guys have any questions, just message me. I thank you guys so much. You have been so kind. I thank you, thank you, thank you. You guys have a great lunch, and I'll see you guys later.